6 months into the worst Ebola epidemic in history, the world is losing the battle to contain it. Leaders are failing to come to grip with this transnational threat.
In a speech to the United Nations member states at the beginning of September, MSF's international president signalled the failure of the current strategy for combating Ebola. No organisation, and that includes MSF, is equipped to deal with the explosion in the number of cases, the dozens of infected health workers, and collapse of the affected countries' health systems.
Many of the member states represented here today have invested heavily in biological threat response. You have a political and humanitarian responsibility to immediately utilize these capabilities in Ebola-affected countries.
MSF teams in the field are utterly overwhelmed. They've treated over 1,000 confirmed Ebola cases in 5 treatment centres since the epidemic began. As soon as a facility opens, like here in Liberian capital Monrovia, beds fill up.
All areas, all districts of the city today have people dying and people getting sick every day. They are asking for help. They don't know how to respond to this, because if they call the hotline, nobody will come and pick them up because the system is completely overstretched. There are too many and the response is too weak.
MSF staff see coercive measures such as enforced quarantine only add to the panic and increase the risk of civil unrest. Equally counterproductive is cancelling international flights. Not only does it compromise humanitarian aid efforts, but it also weakens countries already in crisis. Punishing or isolating affected countries won't turn the tide of this unprecedented epidemic. The urgent need is for more treatment centres, more mobile laboratories and more skilled staff.
Nous sommes évidemment très contents de la libération de Chantal.
We are of course delighted that Chantal is free. We had no news of our colleagues for over 12 months, not since July 11, 2013 to be precise. So obviously her escape is a huge relief to everyone at MSF and to the crisis unit team, who over the past year have put so much into trying to find them.
Avec des gros moyens depuis plus d'un an. Chantal va relativement bien.
Chantal is relatively well as somebody who has spent 14 months in that kind of situation can be. She's tired and she's lost weight. The last days of her captivity were grueling. She managed to escape during military operations.
Elle a réussi à s'échapper en profitant de manœuvres militaires. 3 des membres de l'équipe qui étaient à Kamango.
The 3 other members of the team, who were in Kamango in July 2013, are still missing. Our thoughts go out to them. The crisis unit continues to search for our 3 colleagues and make contacts, and we hope that they too, like Chantal, regain their freedom very soon. We remain fully committed to finding them.
Les pas de Chantal et retrouver une liberté.
They couldn't escape the bombing, and now they can't go home, even though the war weapons have been silenced. The return to calm is relative for the many Gaza Strip inhabitants living without water or electricity in overcrowded schools or several families to an apartment.
After this war, I don't think there is a hope. What hope after all these destructions and after the old buildings that was destroyed? I think Gaza needs more, as they say, 20 years to rebuild and to set up all the structures in Gaza. Everything is destroyed in Gaza.
The Israeli offensive protective edge left over 2,000 people dead and thousands of casualties. Hospitals certainly won't be enjoying the return to peace, as the most seriously wounded will need multiple operations and other patients dressing changes and physiotherapy. And the psychological scars, especially children's, are going to need healing too. This was Lecco refugee camp at the end of August, a lake of half-submerged huts. water stagnates on the flat, bare terrain, making the camp uninhabitable for the 36,000 refugees during the rainy season. The only dry area is alongside the road running through the camp.
Those that are able to live in the camp or in the area find space along the road within the camp, they stay there. The others that are not able, they move down to the host community to live among people there.
The United Nations and the Ethiopian administration in charge of refugees have decided to close the camp down without proposing a suitable alternative.
If there is a possibility for the government to look for another area that is close to Lecho camp or other area, at least for this period of the rainy season where these refugees could be, that would be of a great relief, both for the refugees, both for the government, and also for the NGOs that are providing both water, health, and other facilities for the refugees.
Meanwhile, MSF teams keep working. They manage to keep their patients dry in Lecho by raising medical and health centre tents above the natural ground level. But the rain and dire hygiene conditions pose a serious risk to health, and although consultations are usually for respiratory infections and malaria, hepatitis E has now broken out. Doctors working in refugee camps know all too well that epidemics spread rapidly in settings like these, and that more emergency immunisation campaigns are needed to prevent them.
Refugees everywhere should have access to vaccines, to new vaccines, because all of them are vulnerable. And you find that they don't normally complete their vaccination schedule because of the movements from their original homes to a new home. So they are really supposed to get here.
Common respiratory infections can kill, and children are particularly vulnerable. However, PCV vaccine provides protection against one of the main bacteria that causes pneumonia. 10,000 under 2-year-olds in Uganda received the PCV vaccine in July. Beneficiaries were refugees as well as local communities impacted by the waves of new arrivals. South Sudan in 2013, Uganda now, and Ethiopia soon, MSF has decided to make this vaccine systematically available in emergency settings to protect the most vulnerable from preventable diseases. But this requires removal of barriers, such as the very high cost of PCV vaccine. Turkey, Lebanon, Jordan, Iraq. The war leaves its mark beyond Syria, as physical and psychological wounds scar its refugees. MSF teams deliver medical services to these people in bordering countries. Ramtha is in Jordan, just 5 kilometres from Syria. A rocket exploded near 14-year-old Syrian Ruqayya, who is in the surgical unit supported by MSF.
My mother and a neighbour died, and I was wounded. I felt that I had no legs, and then I went unconscious.
Taking care of Ruqayya is Dr. Al-Wash, who fled from Iraq during the Gulf War at the beginning of the 1990s.
When I was a refugee, I meant not being able to provide any medical help to my people. MSF came and asked me to start a clinic. I was over the moon for that. I thought I will grab the chance any time in my life to repay the favor.
To give a face and voice to the 3 million refugees, MSF has produced a web documentary, The Reach of War. Focusing on the day in the life of Doctors Without Borders in Iraq, Lebanon and Jordan, it presents the organisation's work and its patients.